Yeah, good morning my dear students. Today I am going to discuss the topic on capillary electrophoresis. So capillary electrophoresis, there are two types we are using. One is called capillary zone electrophoresis, another one is called capillary gel electrophoresis. So basically electrophoresis is nothing but the separation of the cations under the influence of electric field. So positively charged ions will migrate towards the negative terminal and negative charged ions will be migrating towards the positive terminal. So what is happening in capillary electrophoresis? So we are using a capillary tube which is made up of fused silica capillary, right? This capillary tube will be there which is inserted in two reservoir, buffer reservoir. There is one buffer reservoir here, there is another buffer reservoir over here, right? And one is anode and the other one is cathode, right? Cathode is having the negative charge, anode is having the positive charge. And we are connecting with the power supply, right? So this power supply we are applying the high voltage in electrophoresis, particularly this capillary electrophoresis or capillary gel electrophoresis we are using or zone electrophoresis we are using. Generally we are applying the voltage of 30 to 50 kilovolts, right? And current, whatever current we are applying, that should not be more than 100 microamperes. That is the current we are using as such, right? And the sample we have to apply it in the center of the capillary tube, right? And the dimensions of the tube is also very, very important. Generally, there is a long capillary tube, around 100 centimeter we are taking, and the internal diameter of the capillary tube will be very, very narrow, say around 50 to 100 micrometer. So this is what we are basically using, 50 to 100 micrometer we are using, right? And the detector we are keeping it towards the cathodic terminal. Originally, if you want to separate them, you have to keep two detectors, one at the anodic terminal, one at the cathodic terminal. But with one detector also we can able to measure them. I will tell you how it is possible. With one detector also we can able to measure the things, right? Now, if you look at this capillary zone electrophoresis, it is a charge balance required equal number of anions and cations, right? When voltage was applied, whenever you apply the high voltage, say 30 to 50 kilovolts, the anions present in the sample mixture will be there in the center of the capillary tube. So what will happen? The anions will migrate towards the anode and the cations will migrate towards the cathode. Cations means the positive charge, right? Anions means negative charge, right? So the anions will be migrating towards the anode and the cations, which is having the positive charge, they will migrate towards the cathode, right? The ions of increased electrophoretic mobility would move faster, and if the mobility differences among the components were great enough, they could be separated. So this is depending upon the electrophoretic mobility, the ions will be getting separated. Migration velocity is fairly slow, that is centimeter per minute range, and if long capillary is used, it takes long time. If you are using a very long capillary, it will take much more longer time for separation. To measure both the cations and anions, one would need detector at each end. So we have to use two detectors at each end, but with one detector also we can able to measure, right? We will discuss how it is possible, right? So one detector is sufficient. If the sample mixture introduced at left end of the capillary, suppose if I am introduced the sample mixture at the left end of the capillary and buffer is allowed to flow from left to right. If the buffer is allowed, the buffer solution, these are the buffer solutions present here, and if the buffer solution is allowed to flow from left to the right terminal, so what we can understand, at a speed exceeding that of the greatest migration velocity of anions. So when the buffer solution is migrating at a speed which is greater than the velocity of the anions, so what will happen? The cations would pass the detector first. Automatically the cations will pass the detector first. So this is the logical approach we are using for capillary zone electrophoresis, right? Now, when we discuss about this aspect, we should also remember that what is the sample mixture, what is the sample volume we are using. The sample volume will be a nanoliter volume we are using. So another important aspect, how will you apply the sample? There are two methods of applying the sample. We will discuss it later on, but we should know that one is called hydrodynamic injection and the other one is called electrokinetic injection, right? On which condition we are using hydrodynamic injection and electrokinetic injection, we will discuss it, right? Now, following cations, anions migrate in a direction opposite to the faster buffer flow, right? First cations will be moving towards the cathode. Now, following the cations, anions will just migrate in a direction opposite to the faster buffer flow. So, automatically the faster buffer flow will be there, anions will migrate towards them, would pass the detector in inverse order of their mobilities, right? So this is another aspect. One must cause the buffer to flow towards the detector simply by raising the anode reservoir. If you raise the anode reservoir, this is an anode reservoir. If you raise the anode reservoir, automatically what will happen? The buffer will flow towards the detector simply. So we have to just move this thing. We have to lift up, right? We have to lift up this thing so that what will happen? Automatically the ions will move towards the reservoir as such, particularly towards the terminal of detector, right? So already we discussed the current should be less than 100 microamperes, all these things we discussed. We have this capillary tube which is basically fused silica capillaries. What is an advantage of this fused silica capillaries? It is having the ability of the surface selenol groups to lose the H plus ions and forms a chemically bound layer of negatively charged groups in aqueous solution. So when we are using above pH 2, when we are using the pH range, pH of the electrolyte solution is very, very important. Both the pH and the ionic strength of the buffer solution is very, very important. So if you maintain the pH above 2, what will happen? The selenol groups, we will be having selenol. Silica group means SiOH, right? So what will happen? When you maintain the pH of above 2, what will happen? It will be just converted into SiO minus. So the hydrogen will be lost, right? And they will lose the hydrogen ions and form a chemically bound layer of negatively charged groups in aqueous solution greater than pH 2. So what will happen? You will be getting SiO minus, right? But when this happens, these excess bound negative charges are partially neutralized by tightly binding positive ions from the buffer electrolyte used in capillary zone electrophoresis analysis. So when we have this minus ion, so it has to be partially neutralized by the positive charged ions from where? From the buffer electrolyte used in the capillary zone electrophoresis analysis, right? So what will happen? Well, they can do to some extent, but the rest of the excess negative surface charge, will be further neutralized by the presence of excess cations in diffuse double layer very close to the silica surface. Okay, that means we will be having an electrical double layer. From the electrical double layer at the surface, so some of the cations will come and neutralize the rest of the negatively charged silica ions, SiO minus ions. Okay, so how you will get the electrical double layer at the surface? If you polarize an electrode. Okay, if you polarize an electrode, automatically it results in the electrical double layer at the surface, right? So the diffuse double layer cations, they are not tightly bound. If you look at the double layer, the cations are not tightly bound with the double layer, so they can move in response to the applied electrophoretic voltage. So how much electrophoretic voltage you are applying, accordingly the cations which are present in the electrical double layer, they will come and neutralize the rest of the negative surface selenol ions. Because they are in excess in this layer, more buffer cations are flowing towards the cathode than buffer anions towards the anode. So this is also one of the important point, because they are in excess in this layer. This cations are excessively present in this layer. So more buffer cations are flowing towards the cathode than the buffer anions towards the anode. So always the positivity cations will be fasterly migrating towards the cathode. This is the reason, right? So this excess cationic flow in this layer, whenever this excess cationic flow in this layer, they drags the buffer solution also as a whole towards the cathode. This is an advantage. When you have an excess cation present in the layer, so what will happen? During the movement, they also drags the buffer solution more and more towards the cathodic terminal. And this is called electroosmotic flow. Okay, this process is called electroosmotic flow. The movement is called electroosmotic flow. You know that osmosis means the concentration from low concentration to high concentration, right? And the flow is called electroosmotic flow. So when you have this electroosmotic flow, automatically what will happen? There will be more cations moving towards the cathode and you can easily capture with the help of detector. Now if you want to change the flow of this whatever the charge is coming towards the cathode, if you want to inverse the charges, so if I want to go for reversal of the electroosmotic flow, that is also possible. You have to add some excess cationic surfactants like cetyl, trimethyl, ammonium bromide. If you use excess of cationic surfactants, so what they will do, they will reverse the electroosmotic flow, EOF. the thickness of the diffuse double layer which mediates this flow is inversely proportional to the concentration of the buffer. This is also very important. These are the factors, right? Whenever these type of phenomena takes place, the thickness of the diffuse electrical double layer which mediates this flow is inversely proportional to the concentration of the buffer, or we call them as ionic strength. So change the buffer electrolyte composition. If you change the buffer electrolyte composition, they will affect and control the velocity of the electroosmotic flow. This is the first important parameter. And if you decrease the pH of the buffer, if I decrease the pH of the buffer, automatically they decrease the dissociated selenol surface charge density, and therefore they decreases the velocity of the electroosmotic flow. So this is an advantage. This will increase the speed of cations moving towards the cathodic terminal and detected by the detector very fastly. Okay. So if you want to do this thing, what will happen? If you decrease the pH of the buffer, instead of going more than 2, if you decrease the pH of the buffer, what will happen? The velocity of electroosmotic flow also will be decreased, right? And there are two things we should remember here: the sample injection and the detectors. What type of sample injection we are doing in capillary zone electrophoresis or capillary gel electrophoresis? The same thing, capillary gel electrophoresis, inside we are using some jelly material. Right, inside the capillary we are using the jelly material like polyacrylamide or agarose as a gel material. They are too much viscous in nature, right? So that is the only difference. So what are the two types of sample injection we are using? Sample injection can be done with either hydrodynamic injection or electrokinetic injection. So what is hydrodynamic injection? Generally hydrodynamic injection, what we are doing, we just take the capillary tube, which end we are going to inject the sample. Suppose I want to inject the sample at this end. So what I will do, I will just dip it in the buffer reservoir, right? So I will just inject the sample in this end by dipping it in the buffer reservoir, and then just keeping it little slightly up and then moving towards the cathodic terminal. That is detector also we have to keep on the other side. Now what will happen? In case of hydrodynamic injection, we are applying the constant hydrostatic pressure. When you just apply, when you put the injection on the capillary one end of the tube, we just pass the hydrostatic pressure. So the hydrostatic pressure makes the sample ions moving into the center. Is it clear? That is called a hydrodynamic injection. So whatever the hydrostatic pressure we are using, that will try to move the sample ions into the center of the capillary tube, right? So that is why we are having two important factors, very important factors for the successful of capillary gel electrophoresis or capillary zone electrophoresis. One is called voltage and the other one is called pressure. Generally the hydrostatic pressure will be applied in a constant manner so that the flow of ions into the particular area will be passed inside the capillary tube, because capillary tube is very, very narrow, right? That is called hydrodynamic injection. Normally nanoliter volume of the sample is sufficient. And other one is electrokinetic injection. What is this electrokinetic injection? Electrokinetic injection is basically we are applying the voltage across the capillary. Okay. So when we are applying the voltage across the capillary, in electrokinetic injection, two features are taking place. One is the migration of the ions because of electrophoretic mobility takes place, and also entrainment of this particular electroosmotic flow. These are the two factors taking place. In electrokinetic injection, one is the migration of ions due to electrophoretic mobility, and the second one is that you will be having this particular entrainment of electroosmotic flow, right? So these both the features are taking place in electrokinetic injection with the particular voltage applied at the point of injection in the capillary tube, right? Now when we do electrokinetic injection, when we do hydrodynamic injection, remember that generally hydrodynamic injections are mostly preferred. Why? Because in electrokinetic injection we are applying the voltage, so there will be a migration of ions due to electrophoretic mobility. Also there will be an entrainment of electroosmotic flow. Even though the entrainment of electroosmotic flow is little less in case of your electrokinetic injection, but still then what will happen? There is a difference between these two, and that difference causes the deviation in your quantitative analysis. When you go for the quantitative analysis, definitely electrokinetic injection is not preferred at all. Okay. But one thing you should remember, when case of capillary gel electrophoresis, if you go for gel electrophoresis, gel material when we are using, they are too much viscous. Okay, they are very very viscous in nature. So in that case you better go for electrokinetic injection. Okay, they are very very viscous in nature, so better you can go for electrokinetic injection. So based on that we can know that proteins can be easily separated by capillary zone electrophoresis. Simply we call it as CZE. Whereas if you want to separate the rugged nucleic acids, so the better option is capillary gel electrophoresis will be the better option as such. This is another important aspect you should remember in your mind, right? And last one is detectors. What type of detectors we are using here? As I told, detectors, there are different detectors. We can use it with the capillary gel electrophoresis or capillary zone electrophoresis. One is UV based detector, another one is fluorescence based detector. Then we can use a miniature amperometric or conductometric detector. This is also possible. Very small size, miniature, because we are using capillary tube. So miniature amperometric detector or conductometric detector can be used because ions will be coming, no? So you can able to trap the ions with the help of conductometric detector, as well as you can also use the amperometric detector, right? Particularly oxidized substrates and all, we are using amperometric detector. And then we can also use mass spectrometer as a detector. Particularly the interface used is electrospray ionization interface, right? Mostly we are using this ESI interface in HPLC. So the same mass spectrometer can also be attached with the capillary zone electrophoresis as a detector. So these are all the various possible detectors we are using in capillary zone electrophoresis or capillary gel electrophoresis. Thank you dear students. Thank you very much.